Right, ladies and gentlemen, the topic of discussion now is chronic gastritis and peptic ulcer. Um, Again, the details are in the lectures. We'll focus on gross and microscopic morphologies. Um, First is about chronic gastritis. Now, chronic gastritis can be autoimmune, it can be H. pylori induced. H. pylori related chronic gastritis is more common. Um, when we talk about H. pylori related gastritis, this is how it looks like on microscopy. Um, One important feature is that yes, H. pylori organisms can be identified, and how they can be, where they can be identified. This is the surface mucus, and here you see some tiny organisms lying. Okay, so these may be H. pylori, and the other associated findings um, in this lesion, you might say it's not exactly lesion, it's inflammation, are inflammatory cells that are invading into the surface epithelium. So this here is the surface epithelium. You can see this is the mucus, here are the organisms, and here you can see inflammatory cells that are invading into the surface epithelium. You can see neutrophils, the polymorphs, that is, you can see few lymphocytes as well. In this area you can see some eosinophils as well. Okay, so inflammatory cells in this photomicrograph are seen invading into the surface epithelium. Few organisms are visible. This is the normal lining, and in this picture, in this photomicrograph, you can see very prominent component of um, um, the chronic part of inflammation, that is the lymphocytes. These are all lymphocytes. This is a lymphoid follicle. This area represents the prominent germinal center. These are also lymphocytes. So this is part of lymphoid follicle with the prominent germinal center, which is lymphoid follicles are also a prominent feature of chronic gastritis. Now, this is a complication of, okay, first thing, this is a stain which highlights, it's not very commonly used, but it's highlighting here. You may get this picture in uroscopy. The H. pylori organisms, as I said in the last slide, it's present in the surface mucus, so you can see a lot of microorganisms in this area. Okay, this photomicrograph here represents a complication or a progression of the disease. This is called intestinal metaplasia, which can be precursor to development of carcinomas. How it looks like, how you're going to recognize this in an exam. You see this is a goblet cell, this is a goblet cell. This is a goblet cell. When you see these um, in a scenario where the main diagnosis is chronic gastritis in your opinion, and you're given this picture that this is a complication that is developed. So this is it, this is intestinal metaplasia. These are the goblet cells that can be seen here. Okay, now moving on to peptic ulcer disease. Peptic ulcer disease can develop as a complication of H. pylori related gastritis or other types of gastritis. There can be stress ulcers as well. So generally remembering the peptic ulcer disease, it's what the name indicates, it's an ulcer. This is gross morphology, and here is an ulcer. You can see very clean edges. This is the ulcer base, and this is how it looks like on microscopy. This, you can see, this is normal epithelium, this is sort of normal epithelium, and this is the ulcer base corresponding to this area on gross morphology. This base is formed by granulation tissue. There may be some degraded blood, you can see here. So, and this is the normal ring epithelium. So this is the ulcer base. Main thing you need to remember that granulation tissue is present at the base of this ulcer, and it's an ulcer. Then granulation tissue is present. There may be some bleeding. Bleeding is a complication of peptic ulcer disease, so you might see some degraded blood as well. Okay, so this is it for now. Please let me know if you have any questions. Thanks a lot.